In the next minute, you will hear a warning that could keep you from your next birthday. And if any of these signs feel familiar, you may be standing on the edge of a serious health crisis. Ignoring them could cost you your independence or even your life. Stay with me because this could be happening to you right now. I'm a health professional who has spent years watching seniors brush aside subtle cues that later turned into emergencies. I still remember a neighbor who dismissed a lingering sense of exhaustion, thinking it was just age catching up, only to end up in intensive care a few weeks later. The problem is that many warning signals are so mild, we label them as normal tiredness, a little shortness of breath, or a harmless rash. But the body is sending an SOS, and if we don't listen, the damage can become irreversible. By the end of this video, you will know exactly what to look for, why each signal matters, and a quick step you can take today to protect yourself. Let's start with the first signal, the one most people never even notice. You're tired even after a full night's sleep, and that's a red flag. Persistent low-level fatigue isn't just getting old. It often means your heart isn't pumping enough blood or you're developing anemia. When the heart works harder than it should, you risk sudden collapse or a heart attack. A simple tip: keep a diary of your energy levels for 7 days. If you're still feeling wiped out after a week, schedule a basic blood test. But the most concerning is how quickly this fatigue can turn into a life-threatening event. If climbing a single flight of stairs leaves you gasping, listen up. Shortness of breath during minimal effort is more than a sign of being out of shape. It indicates that your lungs or heart are struggling to deliver oxygen to your tissues. This can be an early warning of heart failure or a hidden clot in the lungs. Ignoring it may lead to a sudden pulmonary embolism or a full-blown heart attack. Try the talk test. If you can't finish a short sentence without pausing for breath, it's time to see a doctor. And almost nobody pays attention to this subtle change in breathing until it's too late. A patch of redness that appears overnight may be more than a simple irritation. An unexplained rash on the chest or back that isn't itchy or painful can signal an autoimmune flare or an early infection creeping through your system. If left unchecked, it could evolve into a severe systemic disease that attacks multiple organs. Photograph the rash each day and note any changes. If it spreads, changes color, or lasts more than a week, get a dermatologist's opinion. This could be happening to you right now without you even realizing the danger. If your clothes are getting looser for no reason, your body is shouting for help. Unexplained weight loss of 5% or more in a short period often points to a metabolic shift, possibly a thyroid imbalance or an early stage of cancer. Hidden malignancies can become untreatable quickly if missed. Weigh yourself weekly using the same scale and time of day. Any sudden drop should trigger a medical checkup. Now I want to hear from you. What do you think about these first 4 signs? Have you noticed any of them in your own life or in someone close to you? Share your thoughts in the comments. I really want to know your perspective. Let's keep going. The next signal is something you might feel in your own hands. A pins and needles feeling that won't quit could be a silent alarm. Persistent numbness or tingling in the feet or hands, known as paresthesia, often means nerves are being compressed or damaged, sometimes due to diabetes or poor circulation. If ignored, you risk permanent nerve loss, loss of balance, and even falls. A quick tip: gently move and stretch your limbs every hour. And if the sensation persists for more than a few days, schedule a nerve conduction study. We'll explore a few more signals after a short break, but remember, each of these warnings is your body's way of protecting you. Ignoring them is like turning a blind eye to a fire alarm that's beeping in the night. If you're finding this valuable, hit that subscribe button and let's keep exploring together. Stay tuned because the next sign is something you might hear rather than see, and it could be the difference between a simple doctor visit and a life-saving emergency. You might think the next warning is just a minor annoyance, but the truth is far more unsettling. Imagine hearing a faint, high-pitched ringing that seems to follow you from room to room, even when there is no obvious source. That subtle sound is the 6th signal, often called tinnitus without a cause, and it is a silent alarm that many seniors ignore.
When you hear that persistent ringing, it is not simply a nuisance of aging.
It can be the body's way of telling you that blood flow to the inner ear is compromised or that a hidden cardiovascular problem is beginning to take hold.
In many cases, the tiny vessels that feed the auditory nerves become narrowed, and the resulting lack of oxygen creates that irritating buzz. The danger here is that this hidden vascular issue can quickly evolve into a stroke or a serious heart condition if left unattended. A practical step you can take right now is to perform a quick, quiet room test. Sit in a completely silent environment for a few minutes, close your eyes, and focus on any lingering sounds. If the ringing persists for more than a few minutes, make a note of its intensity and frequency and schedule a visit with your primary care provider. Ask them to check your blood pressure, cholesterol levels, and to run a basic hearing assessment. Early detection can save you from a cascade of complications that could otherwise strike without warning. And now, as you absorb that information, let's turn to the final, perhaps most terrifying sign that many people never even consider. It is a symptom that can appear silently without pain, but its consequences can be life-changing. I am talking about a sudden loss of balance or a feeling that the world is spinning when you stand up, even if you have never experienced vertigo before. That unsettling sensation is the seventh signal, unexplained dizziness, that comes on out of the blue. It may feel like you are on a boat in a calm sea that suddenly becomes choppy, or like the floor has tilted just a fraction. The underlying cause is often a drop in blood pressure when you change position, known as orthostatic hypotension, or it can be a sign that the inner ear's balance system is malfunctioning due to an early neurological disorder. If you ignore this warning, you place yourself at high risk of falls, fractures, and the loss of independence that follows. A single misstep can lead to a broken hip, which in older adults is associated with a steep decline in overall health and a dramatic increase in mortality risk. Moreover, persistent dizziness can be a precursor to more serious conditions such as Parkinson's disease or a developing aneurysm, both of which demand urgent medical attention. A simple actionable tip is to practice the 1-minute stand test. When you get up from a seated position, take a deep breath and stand still for 60 seconds while observing how you feel. If you notice lightheadedness, swaying, or a sense that the room is moving, sit back down immediately and repeat the test after a few minutes. Record the results and share them with your doctor. Request a basic blood pressure check while lying down, sitting, and standing, as well as an evaluation of your vestibular system. Early interventions, such as adjusting medications or incorporating gentle balance exercises, can dramatically reduce the risk of a severe fall. But low and so concern is the twist that ties all these signals together. You may think each warning stands alone, yet they often share a common root: chronic inflammation and the gradual wear and tear on our circulatory system. When the heart, blood vessels, and nerves are subtly strained, they send out these quiet distress calls, hoping we will listen. Ignoring one sign makes it easier to dismiss the next, creating a cascade that can culminate in a medical emergency that could have been prevented with simple, timely actions. Think about it for a moment. If you have already noticed any of the earlier signs, persistent fatigue, breathlessness on a short walk, an odd rash, unexpected weight loss, tingling in your extremities, ringing in the ears, or sudden dizziness, your body is already shouting for help. Each symptom is a piece of a larger puzzle, and putting the pieces together early can mean the difference between a quick clinic visit and a life-saving intervention. Now, I want you to pause and reflect on what you have just heard. How many of these signals have you experienced, perhaps without giving them a second thought? Which one feels the most alarming to you right now? Take a moment to write down any that ring a bell and share them in the comments below. Your story might be the catalyst that prompts another viewer to seek the care they need before it's too late. Before we wrap up, there is one final urgent reminder. Even if you feel perfectly fine today, these silent warnings do not wait for a convenient moment. They can appear suddenly, and the window for effective treatment can close faster than you anticipate. The safest path is to adopt a habit of regular self-check-ins, just as you would check the oil in a car or the battery in a phone. A few minutes each week, noting any changes in energy, breathing, skin, weight, sensation, hearing, or balance can become a powerful defense against hidden illness. In closing, remember that you are not alone in this journey. The body has an innate wisdom that tries to protect you. It merely needs a listening ear. By paying attention to these 7 silent warning signs, you empower yourself to act before a problem becomes a crisis. Choose to be proactive, choose to seek professional advice when something feels off, and choose to keep moving forward with confidence and health. If this video has opened your eyes to the hidden messages your body might be sending, please give it a thumbs up. Your support helps this information reach more people who could benefit from it. And if you found value in this conversation, consider subscribing so you never miss future insights that can keep you and your loved ones safe. Together, we can turn fear into knowledge and uncertainty into action. Stay vigilant, stay caring, and remember, the best defense against illness is awareness. Take the first step today and let your health be the story you proudly share tomorrow. But before you go, let me share a quiet moment that still haunts me. I once visited a neighbor who had always been the picture of vigor, a retired carpenter who could still lift a sack of wood without a sigh. One morning, he mentioned a faint ache in his chest that he brushed off as a muscle strain from gardening. He laughed it off, saying he would rest and it would pass. Within a few days, that ache turned into a pressure that stole his breath, and by the time he finally called for help, the doctors told us that the warning signs had been there all along, hidden in the fatigue he dismissed and the shortness of breath he ignored. He survived, but the recovery was hard, and the fear of losing his independence lingered long after the hospital curtains were drawn. That story is why I speak to you today with this urgency. The body whispers long before it shouts, and if we learn to listen, we can keep those whispers from becoming cries for help. Now imagine a simple habit that could change the course of that story for you or someone you love. Every week, set aside a quiet moment, perhaps after your morning coffee or before you settle into your favorite chair. Take a notebook, even a piece of paper, and write down 3 things. How much energy you felt yesterday, whether you breathed easily while climbing the stairs, and if any new spots or sensations appeared on your skin or in your hands. This isn't a medical exam, just a gentle check-in with yourself, a way to catch patterns before they become emergencies. If any entry feels off, make a note to call your doctor. A quick call can turn a potential crisis into a routine appointment, and that call could be the difference between staying on the porch watching the sunset and being confined to a bed. You might wonder, what if I'm already too far along to catch anything? The truth is, the body never stops sending messages, even when disease has taken root. The signals may change, become louder or more frequent, but they are still there waiting for you to notice. That is why the next step after you write down your observations is to share them. Talk to a trusted friend, a family member, or a neighbor. Let them know what you've noticed. Often, an outside perspective can spot a change you missed, and together you can decide whether a doctor's visit is warranted. Community is a powerful safety net, especially for those of us who live alone or have limited mobility. And here's a small twist that many overlook: the power of movement itself. Gentle activity like a short walk around the block, light stretching, or even dancing to a favorite song can reveal hidden weaknesses. If you notice that a simple stretch leaves you feeling shaky or that a brief stroll makes you unusually winded, those are clues that deserve attention. The key is not to push yourself to the point of exhaustion, but to observe how your body responds to everyday movement. That observation, paired with your written notes, creates a clear picture for your healthcare provider, making the diagnosis faster and the treatment more effective. You might be thinking about the people you love and how these warnings could affect them. Consider taking this habit and turning it into a shared ritual. Call a grandchild each evening and ask how they felt that day, or set up a weekly video chat where you both talk about your health check-ins. When you make it a shared experience, you not only protect yourself, but also become a beacon for those who may be too shy to admit they're feeling off. The ripple effect of one person's vigilance can spread through families and neighborhoods, creating a culture where health warnings are heard and acted upon rather than ignored. Before we close, I want to leave you with a final stark reminder. The window for effective treatment can close faster than a sunrise, and every day you delay is a day you give the hidden problem more time to grow. That is why I urge you right now to take that first step, write down what you feel, share it with someone you trust, and if anything feels out of the ordinary, pick up the phone and schedule a checkup. It may feel like a small act, but it is a powerful defense against the silent threats that loom in the shadows of everyday life.
If this conversation has sparked a feeling of responsibility, a flicker of concern, or even a simple curiosity about how your body is talking to you, please give this video a thumbs up.
Your support tells the algorithm that this message matters, and it helps more people who need to hear it. And if you feel that these insights could be a regular part of your life, consider subscribing. By staying connected, you'll receive future videos that dive deeper into practical health tips, simple habits, and stories that keep you informed and empowered. No pressure, just an invitation to stay aware together. Take a moment right now, right where you are, to breathe deeply, to feel the rhythm of your heart, and to recognize that you have the ability to listen, to act, and to protect your well-being. Your health is not a distant future. It is the present moment you are living in. Let today be the day you decide to honor those silent warnings, to turn fear into knowledge, and to choose a path of proactive care. Thank you for sharing this time with me, for caring about your own health and the health of those around you, and for being part of a community that refuses to stay silent in the face of danger. Stay safe, stay vigilant, and remember, the best defense is awareness, and the first step starts with you.